one of the key things that we do with neurological patients is that I want to take them back to where they were in their infancy. As we learn to walk again, an infant learns to roll, then they learn to crawl, and then they learn to pull themselves up, and then they learn to basically stand and walk. So I want any of you that have had an insult, I want you on the floor, I want you on your tummy, I want you out, extending your arms as much as you can, and just allow your body to relax a bit. And then once you do that, I want you to then think about rolling with your head, and then your shoulder, and then your hip, and then following over. And then you can come back, always lead with your head, then your shoulder, then your hip. And you can just continue with barrel rolling. So we move from rolling up to an all-fours position where we can try to initiate crawling. Initially, crawling with some people is that we go from a 4 count. 1, 2, 3, 4. 1, 2, 3, 4. Now, part of the problem that we have with some people is they don't have good balance, even in the all-fours position. So we need to work on just a placement of one hand, and then opposite knee, opposite arm, opposite knee, 4 count. We want that to move into a progression as the balance gets better to a 2-point crawling. This is where we win the battle to stand and walk again. Crawling. You need to crawl, crawl, crawl. Now, from the all-fours position, again, we try to go to a 4 count. And if you can execute this, people that have a lot of spasticity can't initially, but we want to start working on just lifting one arm. And this is really important because it'll help strengthen the muscles of the shoulder girdle that we need so dearly to have the arm raise up efficiently. We'll also get co-contraction of the back muscles, which will allow us to give it a little more strength. Now, then we go from the arms individually, unilaterally to the legs, where we kick out straight, come back, and we're looking for symmetry, quality of movement, to be able to extend back. And then we do the opposite leg, kicking back, straightening the leg out, coming forward. And then we move to the progression. Next progression is opposite arm and leg. And this is really working our balance mechanism. And once you get the balance in this position, most people can then move to the alternate arm-leg movement. Remember, we talked about crossover. Again, it's a cross pattern maneuver. Same thing when we walk. We use the same cross pattern when we crawl. Very important. So if you start to do this, that's a no-no. We want this. Okay? Then from there, we work on coming up into a full knee standing position. And if you begin to lose your balance, the arms come up forward. Now for stroke people, that's important because that's your protective extension. Whether it be sitting and you go to reach, you lose your balance and you're able to extend your arm. This is one way also, Marcus, to break up the spasticity over here. You work on protective extension in the sitting position. So that's very important. So we're going down, touch, coming back, touch, coming back. Once we're in this position, we can work here. Okay, so we're back here doing a little more work on the mat. So we are at the knee standing position. So once we're at the knee standing position, then we can also drop our arms to the side and we can try to do our coordination drills. We can do our A counts while we're doing this. Okay, we can go to long lever, try to maintain our posture, collection as we're working this technique. So we can also work our patterns. And while we're doing this in the knee standing position, we can do our reciprocals starting. So we can run through basically the same type of program that we did with Kelly in the chair, only now in the knee standing position, which is forcing our core and our body to stay collected. We're using our thighs, our butt muscle, and our back muscles, our tummy muscles to work. All this, as this becomes more stable and we're more collected, you can have your a friend or a spouse try to twist you and you try to hold. They can try to tilt you off balance, throw you off balance, forward, back, side to side. Your imagination is the world. It doesn't mean anything you do is not wrong. Any movement pattern that you make is to your benefit. All you're doing is challenging your system. So don't be afraid. Use your imagination. Again, what we gain by what we do on the floor translates to stability when we begin to stand up, which is a whole different, another film. So we'll end it there. Good luck, good exercising.